So, when you hear the name Florence Nightingale, what's the first thing that pops into your head? Probably a heroic nurse, right? The lady with the lamp? And yeah, that's definitely part of her story, but it's not the whole story. Today, we're going to talk about the woman who basically invented modern nursing, not just with her kindness, but with her killer use of data to completely revolutionize medicine.
And that brings us to our big question. How on earth did a nurse use math to save an entire army? Well, the answer is kind of mind-blowing. We're about to see how one of the most famous caregivers in history used statistics, statistics, to fight an invisible enemy that was way more deadly than any cannonball on the battlefield.
All right, to really get what she did, we've got to go back in time. We're heading to the 19th century, into this absolutely brutal conflict, where the biggest threat wasn't the other army, it was hiding in the very places that were supposed to be safe.
Okay, picture this, the Crimean War. The British Army hospitals were a total nightmare. Soldiers would get wounded in battles, survive, and then be brought to a hospital where they'd die from diseases like cholera or typhus. It was awful. The conditions were filthy, and medicine was based more on old habits than actual science. The real killer here? It was infection.
And right into the middle of this mess steps a woman who's about to become a legend. You know her as the lady with the lamp, but as you're about to see, her story is so much bigger than that one comforting image. Yeah, this is the Florence Nightingale everyone knows, right? The tireless nurse walking the dark halls with her lamp, a total symbol of hope and compassion. And she was, for sure. She trained nurses, she fought for her patients, she cared so much. But her most powerful weapon wasn't that lamp she was carrying, not even close.
Okay, so let's shift gears. This is where we move past the icon and get to the analyst. This is where her story becomes truly revolutionary, and where she starts fighting this war not just with care, but with cold, hard facts.
So, what was her secret weapon? Check this out. Florence Nightingale had an incredible mind for numbers. Her dad was a mathematician, and he influenced her big time. She wasn't just trying to help people, she wanted to prove what actually worked, using logic, evidence, and, you guessed it, math.
And listen, this wasn't just some side hustle for her. In 1858, she became the very first woman ever to be admitted to the London Statistical Society. That was a huge deal back then. It showed everyone that she wasn't just a nurse, she was a serious data scientist, way before that was even a job title. She was building her case for a healthcare revolution, one number at a time.
Okay, so she's got this amazing analytical brain. What does she actually do with it that's so game-changing? Well, it was an idea that was so simple, it was brilliant. And at the time, it was completely radical.
Her method, you're going to love this, it was just so effective. She got to these army hospitals, saw how disgusting they were, and introduced a super powerful fix, basic hygiene. She made systematic hand washing and other sanitation rules a thing for all the staff. And then, this is the key part, she tracked the data.
And what happened after she put these simple rules in place? The mortality rate in the hospitals didn't just go down, it plummeted. The decrease was an unbelievable 40%. This wasn't a fluke, it was proof. Hard evidence that being clean saved lives.
That one number, that 40%, it did way more than just save lives during that one war. It basically kickstarted a complete transformation of nursing and public health that we all still benefit from today, probably without even realizing it.
I mean, just look at the difference she made. Before her, nursing was just seen as, like, a chore. She turned it into a respected profession. Hospitals went from being these scary places you went to die to places where you could actually get better. And maybe the most important thing of all, she shifted medicine itself from being based on tradition to being based on proof.
And the best part? She didn't gatekeep any of this. She wrote it all down in her book, Notes on Nursing, which became the go-to guide. She basically created a blueprint so that everyone could learn from her methods, laying the groundwork for all of modern nursing.
You might be thinking, okay, that was the 1800s. Is this still relevant? Oh, absolutely. Think about something really recent, like the coronavirus outbreak. Studies showed that a huge chunk of transmissions, like 75 to 80%, happened within families, in close quarters. It just proves Nightingale's core point all over again. Hygiene is absolutely critical for keeping the public safe.
I mean, just listen to her own words. It sounds like something that could have been said yesterday, right? This one, simple idea, wash your hands, is a direct line back to her work. It's the foundation of how we control infections and protect each other.
So the next time you see a doctor use hand sanitizer or you walk into a clean hospital, you're looking at the legacy of the lady with the lamp. It wasn't just her compassion. It was her brilliant, data-driven mind that proved a simple, logical idea could truly change the world. Her impact isn't just in a history book. It's in all the invisible things that keep us safe every single day.